Hiring biomedical engineers sounds straightforward. Until interviews begin. The resume looks strong. The degree checks out. The title seems right. But then the gaps show up. No real validation ownership. No exposure to FDA design controls. No experience inside GMP production. Strong R&D instincts, but weak documentation discipline. That's where biomedical engineering hiring gets expensive. This matters because biomedical engineering sits in a very specific lane. It's not just engineering, and it's not just healthcare. It's the intersection of technical depth, product responsibility, and regulated environments. When the wrong person gets hired, the cost is rarely limited to time to fill. It can affect validation timelines, inspection readiness, product development pace, and the confidence your team has in the work. A biomedical engineering staffing agency should do more than send engineering resumes. This is not general recruiting. You're hiring people who work in environments where documentation matters, quality systems matter, and product decisions can carry regulatory weight. That could mean a medical device team building under design controls. It could mean pharmaceutical production support tied to GMP requirements. It could mean diagnostics, biotech, or clinical systems where technical decisions need to hold up inside structured processes. The environment is what ties it together. And that's why the title biomedical engineer can be misleading. It covers more ground than most job descriptions suggest. Some biomedical engineers are building prototypes. Some are writing verification protocols. Some are qualifying production equipment, while others are supporting automation or device lifecycle oversight. The question is not just, have they been a biomedical engineer? The better question is, what did they actually own? What did they build? What did they validate? What documentation were they responsible for? That's where real fit starts to show up. In medical device engineering, the bar gets even more specific. You often need people who understand design controls and validation strategy. That experience is procedural. Someone either understands design history files and documentation discipline, or they don't. And when they don't, the gap becomes obvious after hiring, not before.
The same pattern shows up in pharmaceutical environments. A candidate may sound technically capable, but can they work inside qualification protocols?
Do they understand change control, deviation handling, and validation reporting? That's the difference in a GMP-driven environment. For hiring teams, that difference matters a lot, because regulated experience is not a nice-to-have. It's part of the job itself. So, how should a strong search actually work? First, define the environment clearly. Product stage, regulatory exposure, validation expectations. Then, evaluate candidates based on project history. Finally, deliver talent that matches the technical requirements and the operating reality. If your team needs biomedical engineering talent inside regulated environments, KORE1 can help you run that search with more focus and less guesswork.